Hi, welcome to EMS World. I'm John Eric, and we're here today with Skip Kirkwood, Chief of Wake County EMS in North Carolina and a well-known industry speaker, author, and leader. Skip, thanks for joining us.
Good to be here. Nice conference.
Now, as a chief and an attorney, what kind of ramifications do you expect for EMS from the Patient Protection and Affordable Care Act?
From HIPAA?
From healthcare reform.
Oh, from healthcare reform. I expect, I think we're at a crossroads. So I expect one of two things to happen. Either EMS as we know it today is going to sort of become extinct, sort of die off and go away, and something else is going to emerge to take its place. Or we're going to evolve into a much more diverse provider of services. In Wake County, we've sort of stuck our toe in that pond with our advanced practice paramedic program, where we have paramedics who not only respond to 911 calls, but work in the community to prevent 911 calls and to direct patients to destinations that might be more appropriate for them than the hospital ER. In that category falls things like people who need to go to a mental health specialty provider, people who need to go to detox, people who need to go to a mental health crisis center. And we see the articles every now and again that paramedics don't do a very good job of deciding who needs to go to the hospital or not. That should come as no surprise to us, because in my paramedic school and pretty much everybody else's paramedic school, we got exactly 0 minutes of training in how to make that decision.
Sure.
So why should we be surprised if without further training and guidance, paramedics can't make that decision well? But there is a whole bunch of needs out there, and if like any entrepreneurial business, if you want to grow and expand and diversify, you have to identify needs and you have to go meet them. Hospitals, I think, are going to be a big potential client for us, because part of healthcare reform involves providing hospitals incentives to provide a quality care and disincentives when it doesn't work. So, for example, if a hospital discharges a patient, say, who's newly been diagnosed with congestive heart failure, not only will they be measured on how they treated the patient, but someone's going to look at whether the patient went home and did well. Or if they were readmitted to the hospital within a period of time, then there's a penalty for the hospital, because obviously they didn't solve the problem. They just tucked it in and sent it away. So I see an opportunity for EMS to be partnered with hospitals to help make sure that that patient goes home from the hospital and really understands their discharge instructions and really does get their prescription filled and really does take their medicine. So I think it's an exciting time, and in large part, which direction we go, I think, is up to us. If we want to stay in our comfort zone and keep carrying everybody from the house to the hospital and dropping them at the ED, I think somebody else will spring up. In the United Kingdom, there's evolving what they call the emergency care practitioner. Started out as a thing that you had to be a paramedic first, but now it's evolved, and you can maybe be a respiratory therapist first, or a nurse first, or some other allied health profession, and take the necessary training and become an emergency care practitioner. So if we don't just want to be the medical taxi service, we need to scan the environment, look for opportunities, and then further educate, further train ourselves to be able to fill those needs in the environment.
Skip, what other challenges are facing systems like yours today, and what else should EMS systems be doing to prepare to move into the future?
I think the biggest challenge we're facing today, and we're going to face more in years to come, is the whole human resources issue. As a nation, we're about to try and replace a workforce of 80 million people, the baby boomers and before, with a workforce of 30 million people. That arithmetic is tough. And if we don't provide the next generations of employees the kind of working environment that they want to work in, they're going to have plenty of other places to work. And I, for one, would like, in 25 years from now, when I need an ambulance, I'd like it to come with a bright, motivated, well-educated paramedic who knows exactly what to do for me.
Certainly.
So I see this whole workforce thing as being sort of the greatest challenge that faces us. And along with that, I see sort of an ever-widening gap between what comes out of paramedic schools and what employers need. The EMS education and training has changed over the years. In the early years, paramedics were trained in an academy environment where they not only learned the didactic material and the psychomotor skills of starting an IV or intubating a mannequin or whatever they did, but they learned how to be employees also. And as education has transitioned into the academic environment, that last component has fallen off, along with some of the other things that are more difficult to teach. For example, on every call we go on, a vehicle is operated, but we don't spend near as much time in EMT or paramedic school on vehicle operations as is necessary to produce a proficient ambulance operator. On most calls, we lift and move a patient. That requires a certain amount of physical skill and agility and so on. Yet in most EMT and paramedic schools, unlike most fire academies or police academies, there's no physical component whatsoever. So as far as the agency challenge, if the schools don't do it and it's necessary to do the job in the field, then the agency is left to fill that gap. So I see the role of the field training officer in EMS becoming more sophisticated, more formalized, better training, compensation for the role, so that there can be a cadre of people who know what to do to bridge this gap between I graduated school and I got my paramedic license, and here's all the things that I need to know before I can actually go out in the field and be a productive member of the organization.
Very good. Skip, thank you for joining us.
Hey, it was a pleasure. We'll see you again. Have a good conference.
You too.